Hi, this is Colleen with Chats with Colleen. Thank you so much for joining us today, tonight, or whatever day it is. We appreciate you and your time. Remember, we record every other week and we release the episodes then as well. So we are looking for guests to join us. If you're interested in joining us, please reach out via email, text, or DM us, and we'd be glad to have you on to discuss any topic in your life or any career or story that you want to share to help and motivate others. So thank you again. And our guest this week is Anna Grono. She is the owner and developer of Luminous Skin Med Spa. It's right here in Longwood, Florida. And on top of that, she is also a nurse practitioner that helps in the world of ALFs and people to help with their psychiatric conditions, which is great because there's so many people in this world that need her help. In addition to that, she worked about 14 years in women's health at Winnie Palmer. So she has great, vast knowledge and experience for all types of health and helping people feel better about themselves. And that's why I'm excited to have her here so we can learn about her career, her past, how she balances it within her life to fulfill her life and fulfill other people. And if you have any questions or would like to learn more about it, please tune in. And also you can reach out directly to Anna. She is on the internet. Her website is luminousskinmedicalspa.com. And she's also on Instagram. And you can also DM us for her direct contact information. So thank you again. Enjoy the show and we appreciate you. This is Colleen with Chats with Colleen. We're so glad that you're here joining us today. And today I have the pleasure of having Anna Grono with Luminous Skin Med Spa with us. She's helped me with my skin so much. So I'm so excited to have her here and learn a little bit about her and her past and how she got into this. So Anna, thank you again for joining me on this Saturday.
Of course, thank you.
You're
Yeah.
welcome. And I want to know, what is your exact job title and your license?
So my exact job title is nurse practitioner. I hold my nurse practitioner. There's a couple venues that you can go into, and mine is in family. I wanted to keep mine as broad as possible when I went back to school because I wasn't really narrowing that. I didn't want to limit myself to certain things. So I felt like family, you can kind of move into different entities of nursing that way easier. So that's what I ended up doing.
Okay, so when you first became a nurse, you didn't become a nurse practitioner at first,
Right. No,
right?
not even close. Yeah. When I went back to school, I actually had my associate's degree for most of my nursing experience. With you can get an associate's or you can get a nursing and a bachelor's in nursing. So when I came out with my associates, I was finishing a marketing degree and I decided I wanted to be a nurse. I went back, got my associates, and worked in labor and delivery for 14 years.
Oh my gosh.
Yeah,
Wow.
it was a lot of fun. And you can do that. I worked alongside a lot of girls that had bachelors, but at that time I was starting a family and I was a little, nursing school was very different than getting my marketing degree. So I was a little bit overwhelmed and kind of took time to just start my family. And I loved working in labor and delivery during that time. And it just worked really nicely with everybody's schedule when they were little. And then when I went back I had a third child. He was a little under a year and I wanted to do something different. And so I love women's health. And so I went back to school. And at that time, it was before the pandemic, but a lot of schools were doing online classes, and a lot of the master's programs catered to women that were working because a lot of the girls that were going back for their master's in nursing were already RNs. So or at least I wasn't able to quit work entirely and go back to school. So they had these programs set up where you could do both, and they kind of accommodated the working nurse. So I went back when he was little. My girls were in school, and I just did everything when everybody was out of the house, mostly during naps, things like that, and got through I did a bridge program. I got my bachelor's and my master's at the same time, and it took me about 3 years. So it wasn't the most fun 3 years of my life, but I knew there was an end to it and I got through it and I'm happy I did.
Oh my gosh. So you've been in nursing for a long time. I
A long
wonder
time.
and did you say that you worked at Arnold Palmer or
I worked at
Winnie?
Winnie Palmer. Yep,
Okay.
right when it opened, I got a job there probably a couple months after it opened.
Okay. So,
It's
because I
all
had my
women's health.
son at Arnold Palmer,
Right.
so I'm assuming you weren't working there. I was like, oh, maybe she was a nurse when I was there.
Not yet. It
No.
was that, yeah, it was at Arnold Palmer, and then it just grew. I mean, Central Florida area grew, and they started that. Winnie Palmer is just women's health, so they moved everything women's health related to that hospital.
And you said you had a degree in marketing. Did you
Hmm.
ever actually work in any marketing type fields?
I worked in sales for Universal for a little bit, but
Okay.
I didn't. I was I think I was a coordinator, and I, I had the opportunity to kind of advance with it, but it was at that time I was getting married and realized I wanted to be a mom, and I wanted to be, a mom. So I needed to find a job that fit, my schedule, and I wanted to work somewhere where I felt like if I have to be away from my family, I want it to serve a good, strong purpose. And nursing just fit all the things I, kind of desired at that time.
Yeah, well, I wanted to be a nurse, so that's what I started to go to school for. And then
Yeah.
it kind of freaked me out, the blood and some of the stuff. And I got
Sure.
pregnant and had a baby. And then I realized, like you, I couldn't do both. Like I had to work because I had the baby that I had to support. So I think it's great that they have jobs and school like what you did that can help you balance it.
Yeah.
Because now it's like online school has made like big waves in the world, which have made a
Huge.
lot of things possible for people.
Right. And I think it's gotten better even after the pandemic because a lot of
Mhm.
those universities had to provide online courses, maybe that they weren't doing before. It's gotten even
Right.
better. So in my personal opinion, I think it's
I think so too.
allows a
I
lot more
really do.
opportunity.
A lot more opportunities for people to be successful at it too, you
Yeah.
know. Hmm.
Yeah.
That's good. And so you kind of talked on this a little bit, but how do you balance being a mom, a young mom, and a nurse? Or how did you balance it back
uh,
then, and how do you balance it now?
Yeah. So, I don't have any real answers. I would say I yell a lot, so that's how I get through everything. My kids probably would agree when they were little. Like, my oldest is 18, and she's about to leave for college now. And she was telling me, I remember when I was little and I would get home from school and you would be sitting in the dining room and you'd have all your paperwork out there and you would just be always, she was like, you were either reading or writing something or on the computer or so, I tried to make sure, I don't know. I feel like there's something has to give. If you're working towards something, that means something else in your life is giving. I just always tried to make sure that I prioritized what I felt needed to be prioritized. That's I had never been more organized than I was at that time because I knew when my kids got home from school, if I was doing schoolwork, I wasn't able to study for a test. I could write a paper. I could, I was visibly there too, and I could check in with them. We're in the same house, but I didn't want to be too overwhelmed. So I made sure that, like I mentioned before, I optimized my time when they were in school. As if I wanted to take a nap, if I wanted to like, I don't know, watch Real Housewives or catch up on TV or whatever it was, I made sure I didn't do it. I could do that stuff later. I
Hmm.
I made sure that I got done with the school that the stuff that I needed to do for school in that little window that I had, and it forced me to be just probably more organized than I've ever been in my whole life because I knew if I left it for nighttime and I'm putting the girls to sleep or my son or my husband's now home and that wouldn't have worked. It would have been horrible. So I just got
Too
really
chaotic.
organized.
It's too chaotic. Yeah. Being a mom takes a lot of
It
organization,
sure does.
especially when you work and you have all these other things. And then, your kids are your main priority. So you have to, all of their activities Yeah, so I know
Yeah.
that I have papers all over my table downstairs right now
Yeah.
too.
Yeah.
Work is like spread out, but I remember when I had my son, I would do the same thing when he did his tournaments and his basketball. If I could be in the car because I couldn't watch him practice because parents couldn't go in, I would be in the car working because it was just
Yep.
like I have to use the time, like
Yep.
his time. I'm here with him, supporting him, but I can't be in there, so I'm out here doing this. And I think like the kids noticed it, kind of like you said, your daughter was like, oh, I saw you, you
I
were always
remember.
working.
Hmm.
But that's like a good role model for her because she's seeing that.
Right. Well, that's what I was going to say for my daughters specifically, because I have two girls and I have a son. And I always wanted them to see that I could still do things. You can be a mom and you can still achieve things. You don't have to stop. Right. But I always did make sure that I always, and I ask them now, even still, did you feel like I was not available? And they will always say, even when I worked, I felt guilty about that. Did you feel like I wasn't there? And all three of them will say, we never felt like you weren't there. So it's like, I don't know. I don't know what the real answer is other than checking in with your kid and making sure that, and I would tell them, mommy's going to be studying for a little bit. And I was never like behind a closed door. I was always available, but,
Hmm.
I wanted them to see that I can still accomplish stuff. You can still accomplish stuff when you're older and a mom and a wife. And, you can still go after what it is that you want to go after in life and make it all work. It's hard, but you can do it, you know?
Absolutely, you can. And now I've seen that you've pivoted to doing kind of your med spa and
Yeah.
your beauty nursing work. How did you decide that you want to maybe pursue more of that in your career?
Yeah, so that all happened because I worked at Winnie Palmer. I worked with a lot of OBGYNs, and they all kind of did like laser hair removal. They would start to dabble in some of the med spa stuff. There was a one group in particular that one of the doctors would come in and she would talk about how they were introducing Botox and they were doing, some of the aesthetic stuff at their office. And so I started thinking that maybe that's what I would do after I got my practitioner, because I knew my practitioner license. I knew a lot of the OBGYNs there and a lot of them personally. So it's, when you're waiting for a baby to come out, you get to know some people. So it was like you could make those connections. And then somewhere towards the end of schooling is when I started noticing that med spas were opening up without having other specialties. That was their own thing. And then I thought, that's what I want to do. When I started learning about that, that's where I kind of really honed in on that's what I want to do. So it was tough. It's tough to get into because, if you're
Mhm.
going to nursing school, you're not learning about aesthetics. They're not trying to teach you
Right.
filler, and you're not learning that at all. So that's kind of something that you have to take on your own education after you get out of school and learn. And it's not always, not to say anything bad about, the industry, but it's not always the most inviting
No, I bet.
industry.
I bet.
So,
I can imagine. It's probably pretty competitive and no one wants to
yep.
share their tips and their
Nope.
trades because if they share that to you, there's potential clients that, or, that they could lose. So I could
Right.
see how they could be kind of snippy and not want to help you.
Yep. It's a niche. So yeah, and it's getting busier and busier, which means there's less, it's more competitive, so it's much
Mhm.
more hold your secrets close to your vest type of thing. But I was lucky enough that I had a friend who owned a med spa, and she was very kind in allowing me to come and learn. And I got some friends, and she allowed me to inject under her supervision, and it was, kind of took off from there.
I was
I
going to
got
ask,
lucky.
so you
I got
learn,
lucky.
I guess it's kind of like when we learned in school how to take blood, we used, I don't want to say
Oranges.
dummies, but we used like, there was like a fake arm. And then
Yep.
eventually we started doing it on our classmates. We started taking the blood and doing injections or whatever on.
Yeah.
So it would be the same thing with the injections for the face. You just learn the technique.
Yep.
And I'm assuming not everybody, it's like anything, like a hairstylist, a manicurist, like not everybody is good at it.
True.
Yeah.
And because there's so much autonomy in your education, it's
Hmm.
really up to the person to educate themselves to whatever extent it is that they want to be educated. And in this industry, it's very, if you're buying product from, let's say Allergan, I don't know if I'm allowed to say that, but let's say that's who makes Botox. They provide a lot of training. So if you,
Nice.
but you as a person have to take that time to, okay, I'm going to go watch that video, or okay, I'm going to go talk to that rep, or okay, I'm going to, 7 o'clock at night, they've got a free training. I'm going to get back on the computer when I'm home, wanting to relax at the end of the day. So it's really up to you to get as much education as you want or feel that you need. And some are probably more, what's the word? Some people crave it and want it and will go after it, and other people don't. It just depends on what your priorities are.
Yeah, and I imagine there's probably trainings and that you can go to, maybe
Yep,
paid or not paid, and but
mostly
like you
paid.
said, yeah, mostly paid, and you have to obviously take the time to go, and it may be on a weekend or evening or a
Yep.
work day, that you're gonna have to miss working or hanging out with your family to go do that,
Yeah,
to learn. But in the end, it's all worth it.
I think so.
So is this the only job that you're doing in nursing, or do you do anything else right
No,
now?
I have another job. So when I got out of the program for my practitioner, I got a job in psych. So I treat patients
Mhm.
with anxiety and depression. And that job I've kept ever since. And then I started this business. I started Luminous Skin, and luckily I'm able to do both until, I'm one day able to do just one. They're both, that job is very flexible and I can make my own schedule. So it allows me, and I do keep a schedule for the patient's sake. I mean, they don't, what patients need to know when to expect you. So I do that a couple days early in the week, and then the rest of my time is spent doing Luminous Skin stuff. So
So
yeah,
with the job with the psych patients for anxiety and depression, do you have an office where they come, or is it home visits, or both?
both. I work home visits, and I work at ALFs. I'm remote completely. There are some practitioners that work in the office. I don't work in the office. I just go, which is why the hours are flexible, because I go to the patient, and I kind of can move my schedule around everybody's needs. So yeah, that's what I do. I go to AL assisted living facilities, and then I go to homes as well, and
For
some virtual.
elderly?
Some virtual. I do like what we're doing.
Yeah. So
Mhm.
are they for elderly or all ages?
Mostly elderly patients is who I see.
Nice.
Yeah.
Well, they're the
I have
ones
a
that need.
couple young, but very rare. And I
Very
don't do
rare.
pediatric. So
No,
yeah.
they got to be 18 and up.
Yep.
Pediatric is difficult, especially nowadays. I wouldn't want to be dealing in the psych or anxiety, depression with the 18 and under. I feel like that is a scary sight right now.
Whole other
Mhm.
specialty, right? It's like that's a different, and I mean, gosh, I feel like I'm going to age myself, but just very different from the way we were raised as well. So it's hard.
Very, very, very. And so with your jobs, both of them, because nursing in a whole for you,
Yeah.
what is the best part of it? Like, what do you find the most
Oh,
rewarding for yourself?
I mean, the easy answer is making people feel better. And I can do
Mhm.
that luckily with both jobs. You know,
Right.
that's the real easy answer right there. They both have, I'm helping people feel better in very different ways. I will say aesthetics. Some of my favorite patients are the patients that are kind of back out on the dating scene for whatever reason. There's a lot of different reasons for being back on
Mhm.
that scene, and that patient to me is very gratifying, because being able to help somebody feel a little bit better about themselves, to then get back out there, and it's an incredibly vulnerable place to be. And I joke with my husband that I would not survive that at all. Like, I would be terrible.
Mhm.
But I like to help in that way. And those are I would say those are the most rewarding, where the patients are now having to start that maybe later on in life and just want to feel a little bit better, and you help them feel a little bit better externally and hope that it what's the word I'm looking for? Like
Transpires into their life.
into their feeling better
Internal.
internally. Right.
Yes. And I know that you started offering or administering the GLP-1 weight
Yeah.
loss injections. And I have a good friend that I just saw her today, shortly today, and she's doing them. And I was like, "You look great." And she's like, "Thanks." And I'm like, "Well, how do you feel?" She's like, "I feel great. I don't even know how much I've lost." And, she was overweight and, had some health issues. So she looks great and
Mhm.
just looks radiant. So, with that being said, I know she's mentioned wanting to get back into the dating world. So it's
Yeah.
just neat that you said that. And so with you offering those, what do you think is the best candidate for somebody who would want to take those injections?
So there's a couple. Most of my patients that I treat with GLP have lost the weight and want to maintain it.
Okay.
So basically, I mean, I could talk about GLP forever, but and honestly, I always tell everybody there's like 5 things I love about it, and the weight loss is probably the 5th thing. I'm on it myself. So um but I think that I maintain most of my patients, like I was saying, are just wanting to maintain it. Basically, what that medication does is it severs the communication between your stomach and your head. It doesn't, you're not driven around by what your stomach is telling you. You're not eating because your stomach is, it allows you to think a little bit clearer without being driven by your physical, body.
Mhm.
Um, did I answer that question? What was
Yeah. Or
oh,
sometimes I feel like sometimes you don't even, I wouldn't feel like it's my stomach that's hungry. I just think it's like my mental.
yeah, you do right. Because I remember before I started it, I was like, well, how's that going to help me? I'm in the cabinet and I'm not even hungry and I'm eating.
Right.
Right. It does. It just somehow, when you're satiated, you get satiated for one. And when you are satiated, you there's just a lack of interest in it. You just are disinterested. You're able to ask yourself, am I really hungry? And then you're not, and you can move on and, I don't know, finish. For me, it's like finish reading a book. Whatever it is you want to do, you're no longer driven around by your stomach. Is like the only way I can make that.
Upset because it's like something that you obsess and you think about all the time. So if it stops
Yes,
that,
it
that's
definitely
something good.
does. There's a lot of like I said, I could talk about it forever, but there's a lot of really negative thoughts that I used to tell myself before I got on GLP, because I drive, like I was saying, my first job, I drive. So when I'm hungry, or if I have a really busy, stressful day ahead of me, my first instinct would have been like, I'm going to go feed myself, and I'm going to get something, I don't know, chicken minis. I would go get whatever it was. I could tell you where a Chick-fil-A is on every route I take, and I can tell you where a Culver's is on every route I take. I don't know if I'm allowed to say those things, but
Yes,
anyways,
you are.
I'm not plugging anybody. I don't own
Right.
either one of those. But I would I would tell myself, I'm going to eat that, I'm going to feel better, and then I'm going to move on with my day, and I'm going to feel like I'm walking on a cloud and it's going to be great. I would stop, I would buy it, I would eat it, I would feel terrible, then I would feel guilty about eating it. Then my stomach wouldn't feel great because it's not pretty, not a great thing to put in your stomach. And then the whole rest of the day, I'd be feeling about, why did I do it? Okay,
Guilty.
tomorrow I'm going to start over. I'm not going to do that tomorrow. I'm going to eat something healthy. And the cycle went on and on. And now my husband eats very, very healthy. He'll make oats. He eats overnight oats all the time. I don't know if that's the most healthy thing. Sometimes it tastes really sugary and delicious, but I can tell you it's probably better than eating the chicken minis. So I will
Oh,
eat that and feel completely satiated. And then I'm not beating myself up all day, and I don't feel guilty about it. I still eat the chicken minis. Let me put that out there. I
of
still eat them.
course.
They're still delicious. But I don't get them as much as I did before. And I don't always finish it. I don't, you get satiated and then you move on with your day. It's that kind of thing.
It's not like, because sometimes I'm like, I catch myself, I like eat so fast. Like, did I even enjoy it? And then I'm just like,
Yeah.
afterwards, and you're like,
Yeah.
oh my God, why did I do that?
Yeah.
So
Or you're
much so.
eating so fast, then you're like, now I feel like I need another. So then you get,
Yeah, it like
two
wasn't
of
enough.
whatever it is. But really,
Yeah.
you're probably not hungry after that
No,
first. But
you're
the
probably not.
time was, yeah,
It was
the
too fast
yeah,
to
it was too
get your
fast.
brain to think that you actually ate
That
something.
you're good. Yeah. So there's a lot. I could go on and on, but that was one of the things, like the toxicity that went around in my brain all day is just not there anymore. It's I feel like I can eat healthier and be satiated and not constantly be thinking about what's my next meal and how am I gonna feel good at that meal? What's gonna, what garbage thing am I gonna eat at that meal next? So it's
Right.
like you just don't do that anymore. You can think clearer.
That's the best way that be. And now that you've explained it, because nobody's explained it, everybody's talking about like the weight loss. They're
Yeah.
not talking about the other obsessive thoughts that you can stop
Yeah.
thinking about.
Yeah.
It
It's huge. And the
is.
weight, and I also want to say weight loss does not equal pure happiness, right? And it
No,
doesn't always yield a better looking figure, because it's
no,
like
right.
other things happen when you have weight loss that if you've had a couple of children, some of those moms will know what I'm talking about. So it's like it doesn't mean everything else is, you know,
And it probably doesn't even
perfect.
mean 100% healthy either, because there's other factors.
That's the
So
truth.
yeah, it doesn't fix, and there's no like magic pill or
No,
magic shot, however you take it. It's all like accumulative. It's how your lifestyle and
how
how
your
you
life
work
is. That's exactly
together.
right.
Yeah.
And as a healthcare professional, it's not really healthy to eat less and then not work out. You still have to, you know, treat your muscles, treat your bones. You still have to eat
Yeah.
healthy for the
Drink lots of water.
longevity. People are
Hmm.
living longer. It's like you have to participate in all the things. This shot to me just makes it a little bit easier and maybe a little clearer on how to do that. That's all.
Right. That's good advice. And what is the most challenging part of being a nurse practitioner?
um well, for me right now, because I work in both places independently, it's so I when I left Winnie Palmer, I left a phenomenal nurses station, and 90% of the people I would say are wives and moms, because the nursing industry it's very heavy on the female side, right? There are
Mhm.
male nurses, and that being said, labor and delivery did not have one male nurse. Again, there are male nurses in labor and delivery. Our unit didn't have any. So that part of it was like just such a bond. And those nurses, I got free anything I was going through in my life, I brought to the nurses station and somebody would have an answer for it. Oh, I've done that before. I've been through that. That's not a big deal. The best and the best advice you could ever get. It was like free therapy all the time. That I miss. When you work independently and you work in your own business and you don't have that camaraderie, that as a practitioner, there's a lot more autonomy. And I think with autonomy comes, you're just on your own a little bit more. And
Mhm.
when you're working in a hospital organization or even as a nurse in a doctor's office, you have a ton of people around. You can ask questions to, you get guidance, you watch other people, and when you're a practitioner, you have a lot of autonomy because you can do prescriptions, you can do full diagnosis, so it's that part is very difficult because you're on your own and it's really up to you. You do have supervising physicians. I do have a lot of practitioner friends that I will text or call and say, hey, what about this? But I guess it's the autonomy. To answer the question, the autonomy would be probably the hardest thing. And you have to build up that confidence as well, especially when you're the one writing the prescription. You're the one you have to know what those side effects are. You have to know what to look for. You have to know if is that the right prescription for that patient. And
Mhm.
that stuff is very scary because when you're a nurse, that's all given to you. When you're a
Right.
practitioner, you're the one.
Right, right, right. I can see that. Yeah. And I can relate to that a little bit in my job, a little bit, because, like, and I have people working in my office with me, but however, I don't really have like somebody that I can more or less consult with, on a
Hmm.
professional level from like professional signing type things. So
Yeah.
you're writing a prescription, I'm signing policies and checks. So
Yeah.
sometimes
Scary.
you're relying on like other people that you may talk to or you may confide in, but then sometimes you're like, oh, but you just have to go, with your instinct. And I guess after doing it, you build up confidence and you just have to know um, that you're doing the right thing.
Yeah. That's it. You get the
Hmm.
experience and then you get the confidence with it. Right.
Yes. Well, I appreciate your time.
Of course.
Um, Anna's office is in Longwood off 434. It's so convenient. It's easy for me to go on a Saturday and fly in there and get what I need to get done. So everybody can reach out to you. Is the best way for them to book an appointment on Instagram or call or text or online?
So you can do any of those. I think the easiest thing would be Instagram because it takes you right to my booking site. Or if
Okay.
you go to my website, which is www.luminousskinmedicalspa.com, it takes you to the book link there too. And then with it, it's really easy. You go to the book link, it drop box, you can pick what you want. There's consultations. I do free consultations. And I'm always prepared to do a treatment on a consultation. I've had a lot of patients that are like, I'm interested in this, but I want to talk about it first. Always. I would never do a treatment and not talk to the patient about it. So consultations, I'm always prepared to do treatments same day, same time. So don't be afraid to
Yeah,
even just book a consultation.
of course. They want to talk about it because they have questions, especially if they've never, had any of those
Yeah.
treatments before.
Even if you have, it's still your face. So
It's still your face and it may be a new person. And
yeah.
then I can say from personal experience, Anna is very personable. She's very easy
Thank
to
you.
talk to and she makes you feel comfortable. And I'm afraid of blood and needles, and she didn't ever make me freak out.
Oh,
I
that's
will
good.
tell you that it was very accommodating, very receptive, very warm, and her office is
Oh,
also really
thank
nice
you.
and
Thank you
very
very
clean.
much.
Yeah, and
Thanks.
very clean. You're
Thank
welcome.
you.
Hmm.
Thanks.
So thank you, Anna,
Appreciate
for
that. Of
joining
course.
us again. I hope you have a good rest of the weekend, and
You
thank you.
too. Thank
Bye.
you for having me. That was
You
fun. I
too.
could talk about this all day long.
I know, and we will later. Thanks so much for listening and joining us. If you haven't already, please share, subscribe, and like our episodes and our podcast. Also, leave a review. It will be so helpful to us, and we would so appreciate it. Also, if you want to join us at any time, we're open to any guests joining us in person and on Zoom. We post and record episodes bi-weekly, so that's twice a month. Um, Also, they're posted on our socials, which is Facebook, Secured Insurance Group, Instagram, Colleen Insurance Lady. This podcast was hosted by myself, Miss Colleen Pacheco, and recorded and produced and edited by Sean Spazzato. Our podcast cover art was designed and created by Norma Pacheco, and our intro and outro music is created by Lounge Bar by Geronic. Goodbye.